particularly important in children, as well as treatment being age sensitive. Speaking in general aspects, the Ministry of Health says 57% of blindness cases in the country are due to cataracts, a condition that can be treated. To help us understand how deep or how bad things are is Jackie Babonerao, Lapea Eyeglasses Uganda official. Welcome to the program.
Thank you.
In my preamble, I grappled with pronunciation of some conditions, and I'll just say that again. Amblyopia, strabismus. What is this?
I'm Jacqueline Babonerao, and I specialist an OCO from Lapea Glasses, Uganda. To begin with, Lapea Glasses is an eyewear company that is aiming at providing eye care to everyone in Africa at an affordable and yet accessible, affordable price and yet very accessible to everyone. Amblyopia, generally, children face a lot of problems. The ones who violated amblyopia, strabismus. Amblyopia is, in layman's language, it's a lazy eye.
A lazy eye.
Lazy eye. The eye does not open very well the way it should open. Ideally, it is too lazy to keep itself open. This one is as a result of taking long to treat refractive errors or prolonged untreated refractive errors. Refractive errors, this is where we have myopia, hyperopia, stigmatism. So the longer we take leaving them untreated, it may result into amblyopia. Then strabismus is basically misalignment of the eyes in children.
Misalignment of the eyes.
Yes, yes.
Explain that. I seem to be confused. Misalignment of the eyes?
Ideally, the eyes are meant to be aligned in a way that, you know.
Is that the squint?
Yes, actually, there.
Okay. Hey, what in local?
They all don't look in the same direction at the same time.
Endali.
I'm not really a Uganda, but it could be.
Locally, that's Endali. The reason I keep ensuring that some of these terms and conditions are perfectly understood in layman's language is that things like amblyopia, strabismus, somebody can miss the point.
Surely.
Yeah. Surely. So Endali, squints, that is misalignment in eyes. All right, go ahead.
Okay, so there are not only those, there are several eye conditions that are affecting children, and these ones, most of the times we ignore them, thinking maybe the child will outgrow this. Some of the times we have got parents undermining some of these conditions, and in the long run they are putting our children at a disadvantage. The more this child grows with this error untreated or unattended to, it is putting this child at risk. First of all, it may lower their grades at school. At times we've got children losing their sight completely. So ideally, eye care in children is very important, and we have to notify parents or other caretakers how we identify these and how we can have them attended to in time.
Okay.
Yeah. So
ideally, those are the most common vision challenges that children grapple with.
They're not really the most common, but of course they are. But they are not as common as the refractive errors themselves. Okay. For amblyopia, it's first of all the refractive error that will result into this amblyopia, leaving it untreated for a long period of time.
So essentially, you must be able to look out for what causes refractive errors, so that you do not find yourself in a position where you're dealing with things or conditions brought about by refractive error.
Sure.
All right, so right now let's bring it home to how the children spend their time, especially during play, both at home and at school. In the process of play, what are the greater dangers that could expose them to problems with their eyes? Because they are crossing roads, they need their eyes right to see at what distance a car is, and then make the decision to dart.
Okay. Unfortunately, in this particular generation where we are in, children have been exposed to these errors much more than the way they used to be later, like earlier on, simply because of the lifestyle we've exposed them to. these days we've allowed children do more of the near activities. They do more of near work than any other time earlier on, you know, those other generations. You know, the more the child spends doing near work, we've veiled them with tablets. They are doing more video games. They are doing more of these inner activities. They don't go out to play. Ideally, they are just always like this on screen, you see? And this may make their eyes get locked up into short-sightedness.
Okay.
Because their eyes are just getting accustomed to doing this, to focusing at near objects. So this is exposing our children to the myopia more, because we are not allowing them to go do outdoor games. I'm advising parents today to take their children out. Okay, the mother is, okay, let them have some little time on the screens. Also take off time, take them out, just have a walk with them, just to interrupt their near activities. I encourage them to go and play with their friends instead of being on TV all the time. Also, these lights we are exposing them to from the screens is so bad. The blue light at that tender age is so much dangerous to the baby's eyes, to the children's eyes. So limit their time on these screens by, you know, sending them outside, take a walk with them, go and play with them. Not making them feel like you're chasing them away from the TV, but just go and do this with them.
That's a hard one. You have to explain to somebody exactly why they shouldn't be watching SpongeBob SquarePants, and then you're telling them, go and do what? Play outside?
Yes, you can take a walk with them,
of course,
actually. Yes, engage them as a parent.
When you talk about time spent looking at and being engaged in what you describe as near work, on my phone, usually, I get an update on how much time I've spent. That is screen time.
Sure.
And sometimes I can be told 13 hours, 7 hours, and I'm taken aback. I'm like, hey, 7 hours on phone, what am I up to? Now, for an average child, or even an adult for that matter, what is the average time somebody should rather spend on, say, a phone or even a screen?
Average time, sometimes these things are inevitable, but this will take us back to the 20-20-20 rule.
What's that?
For every 20 minutes one spends on a screen, or focusing at something, we need to take off 20 seconds and look at something around 20 feet away. 20 feet is close to 6 meters. But for this particular child, there's no way you're going to tell them to look away when they're on the screen. That's why I'm emphasizing, call them out, engage them in something, then let them come back. But for us who are using our screens for all the time, it's our work. The 20-20-20 rule has to apply throughout. Throughout 20 minutes on the screen, not more than 20 minutes. Get off just 20 seconds. You don't have to stand up from wherever you are. No, you can just look around, then get back. At least there you'll have time to blink. You know, when you blink, there's a way you keep rehydrating the eye, lubricating it.
When you blink, it is very healthy.
It is very healthy.
Somebody was telling me.
We always have a rule, don't forget to blink.
Don't forget to blink.
Yes, that one is there.
Somebody was telling me the other day, I think they were watching me on screen, and they said, hey, you blink too much.
Sure, that is very healthy. That is very healthy for you.
All right. I was worried. Because when they said, hey, man, you blink too much, I thought about it and I was like, hey, am I supposed to stare blankly for more than 30 seconds? All right, let's keep it to children and look at the available options that are not medical to prevent some of these conditions. For example, diet and feeding patterns. Just take us through that, and so the average parent can understand how not to drive their children into conditions like refractive errors.
Non-medical practices that can help our children's eye health. Diet, just the way you say, diet in eye health. The most important diet we have is vegetables and fruits. It helps nourish the behind of the eye, that part called the retina. It helps us so much. Then parents also, we have to ensure that we maintain our our children's weight.
Hey.
You know, yes, weight. we have to maintain it, we have to regulate it. You know, when we keep our children growing so heavy, we keep predisposing them to hypertension and diabetes in the near future. So we have to maintain their body weight. Also, we have to do the regular eye checkups. It is, of course, non-medical. It is very important to have these regular eye checkups, especially for children. Always schedule an eye checkup with your doctor. Know the risk factors. If in our family we have got glaucoma, this is a condition of increased eye pressures in the eye. If we know our risk factors, my family, there is this history of glaucoma, there is history of this, there is history of this, then you can understand that, I'm predisposed to this condition, meaning I have to do my regular eye checkups to make sure in case it is detected, it is quickly diagnosed and treated. Then you also have to understand your risk factors. My child plays maybe in a dusty environment, me the father, I do welding and my child keeps coming around. How do I protect my child from having these things hit the eyes? You know, when you understand your risk factors, you understand the child's risk factors, then you can always protect them from that. Then always keep your child like behavior-wise. Always encourage the children to avoid smoking. You know, in future, peer influence. We've seen children starting smoking as young as 12, 13 years. So such behavioral characteristics have to be emphasized amongst children. As the parents, we have to emphasize, because these also affect the eyes. There are quite a number of things. Encourage exercises, body exercises for children. Encourage minimal screen time for the children. There are quite a number of things we can do. Eye exercises, they're also there, a number of them.
A lot.
You know?
Interestingly, when we get an opportunity to listen to experts, especially on aspects that are within our daily way of life, I often tend to move from being a moderator to the parent that I am. Many times when children are being taken to school, it's very early in the morning. And you can see some of them grappling with sleep. Others are told, hey, get the back seat and do your 30 minutes before we get to school. That means sleep deprivation could be one thing that could also cause complications to the eye. Or am I reading too much into this?
No, it is not too much. Actually, enough rest is very important for the eyes. Enough rest is very important for the eyes.
So that means if they're waking up as early as 5 a.m. and required to be at school by 6, they haven't slept sufficiently, and that calls for a rethink or a reform in the education system. That is not, I'm not taking you into that.
Sleep earlier.
All right, so away from the actors in the private sector like La Pair, Eyeglasses Uganda, the healthcare system does provide for many of these services for children who might not be able to afford, or whose parents can't afford, the private care. What is the synergy between government or Ministry of Health and private health actors? Is there anything that you're working on that ought to be told out there?
Anything we are working on?
In terms of service delivery or rollout? Okay, it's a hard question, not a hard question, but one that I'm trying to look at the fact that you are a private company. Yeah, and your services might not be affordable to a Chris Higenyi.
Not really.
So when that happens and you find conditions like cataract in rural areas and these people need attention, so do you do that as CSR, corporate social responsibility?
Or maybe I'll respond to this.
Okay.
What happens is, okay, for us as La Pair, leave alone the thing of private companies being expensive, we ain't expensive because all our eye checkups are free of charge. All our tests are free of charge, that one I must say. Whoever enters our shops or our clinics is entitled to a free eye checkup.
Okay.
For the services we can offer, we do offer them. For those we cannot, we do refer.
Where do you refer them to? That's the question.
Yes, there are several other eye hospitals where we refer. Private or government. The thing is, you can ask the patient where do they prefer to go, or where can they afford, because we know them.
All right.
We know them. Then on top of that, there are several government institutions or private institutions that carry out camps, and in these camps they're offering these services free of charge. So why wouldn't I recommend a patient who has not benefited from us as LAPEA? Why wouldn't I recommend them for such services when maybe Mengo has advertised maybe a free eye camp, or they are doing these surgeries, because us as LAPEA we are not doing these surgeries? Why wouldn't I recommend my patient to go for this surgery, you know, for a squint? You know, we do that several times. And also government hospitals are doing this. We've had Ginger Regional Referral advertising free eye checkups, free surgeries, things like that.
All right. Lastly, eye conditions fall, especially when trying to get around it. Some people find themselves having to live a lifestyle. They want fancy glasses. Others want, what are those things called? The ones they place the
contact lenses.
Contact lens, and then you see them fidgeting and doing all those things in the mirror. And, you know, the children, is it okay for children to put on contact lenses? Yeah. It
could be okay, especially for those that put on very, very high powers, very heavy powers. The only disadvantage is they really need maximum hygiene, which child may not manage.
Okay.
Yes, they need maximum hygiene. So there it really needs a close attention from a relative or an elderly person.
All right. Nice perspective. Many thanks for shedding light on that. Jackie Babonedao from LAPEA Eyeglasses. I hope in whatever you do, do not load yourself with too many contact lenses. There was a story of a gentleman who was taken to hospital, and when the eye who was